Thanks, Nancy. The notice of the meeting was placed in the Ararat Advertiser and the Ararat Advocate on the 5th, 12th and 19th of November in accordance with the Health Services Act 1988. No notice of business was received. The minutes of the 25th Annual General Meeting held on the 16th of December 2020 were confirmed at the meeting of the Board conducted on the 23rd of February 2021.
Thank you, Peter. Good evening and thank you for joining us this evening. On behalf of the Board, I'd like to welcome you to the 26th East Grampians Health Service Annual General Meeting. The Annual General Meeting is an important date on the Board's calendar as it gives us the chance to publicly thank our staff, volunteers, visiting medical officers and community for their support and efforts over the year. It's also a night of celebration as we report on another successful year and present to you some of our organisational highlights and significant events. Tonight, I base the Chair's report on information contained in the printed annual report prepared in accordance with the statutory and government requirements and available on our website, with additional copies available from the executive officers on request. As a report, it contains mostly mandated information from the government. At last year's AGM, we considered the impact of the pandemic, and it has again dominated our lives this year. We're grateful to our staff who've continued to provide outstanding care of patients, residents, and consumers in trying times. The pandemic has brought out the best in our staff, displaying commitment to the health and well-being of our community by finding innovative solutions to challenges and looking out for each other. We've also experienced wonderful displays of community generosity and kindness to our staff and residents. I'd like to take this opportunity to thank my fellow Board members for their support over the last 12 months. Their experience is broad and we appreciate their input into the strategic direction of our organisation. The Board reappointed myself and Fiona Cochrane. We enter our third and final term. I was appointed Chair in July 2018 and will conclude my role as Chair in June 2022. We made a new appointment, Danielle Walker, who you'll meet later this evening. She has served also as our Treasurer. The Board formed a new Board Governance Committee. 2 Board members, Paul Hooper, who served as Vice Chair, and Gabrielle Zanotta, completed their terms this year. We'd like to thank them for their significant contribution and assistance during their 3-year tenure. The 2019-2022 strategic plan is our key strategic document. The 3 strategic goals, better health, better access, and better care, address the challenges faced by our health service and are based on the priorities detailed in the government strategy Health 2040, Advancing Health, Access and Care. The strategic plan implementation framework ensures our strategic plan remains dynamic, meaningful and achievable, and defined and measurable actions for our staff and Board. The Board set a statement of priorities in agreement with the Department of Health and Human Services. The statement of priorities is consistent with the health service plans and objectives. As an organisation, we have identified strategies and put in place deliverables to ensure we are meeting these priorities. The outcomes of the statement of priorities are highlighted in the annual report. Despite these uncertain times, we've been busy with capital development projects, the redevelopment of our second theatre, medical imaging and pathology departments, second lift, and relocation of the palliative care area have been made possible with state government funding of $8.6 million. each area is being upgraded and enhanced, bringing them to first-class standards where we can deliver safe, quality care. The board is mindful that one of the biggest challenges of our health service faces is a sustainable workforce that is knowledgeable, flexible, and qualified to accommodate the health needs of our diverse community now and into the future. We're confident that East Grampians Health Service will continue to provide a comprehensive health service that will focus on the needs of our community. Our education programs are equipping the next generation of health professionals with skills, which will ensure we can continue to deliver a first-rate rural health service. These achievements have been gained through participation and collaboration with other health partners, all tiers of government, tertiary institutions, and of course, our community. It's thanks to the generosity of a number of philanthropic trusts and bursaries that the board has been able to award scholarships to staff to enable them to upskill in their chosen field. Without this level of financial support, it would be more challenging for staff to undertake further studies that continue to assist the health and well-being of our community. On behalf of the board, I wish to acknowledge the Angela Laidlaw Clinical Scholarship, Building for the Future Foundation, Building for the Future Foundation Joe Catt Bursary, and Epworth Healthcare. I want to acknowledge David Hosking, Chair of East Grampians Health Service Building for the Future Foundation. David oversees the management of the foundation. The foundation supports the aim of the health service by raising and allocating funds to invest in its future. Since its inception, the foundation has allocated 29 bursaries to help staff upskill to provide extended capacity for our organisation. Workforce shortages will remain a challenge for us, but focusing on key areas, we've been able to support staff in their commitment to upgrade their qualifications. We're committed to ensuring we're providing safe services for our community. In the past year, East Grampians Health Service has made preparations for re-accreditation of 70 Low Street and Wallora Healthcare, and we await visitors from assessors from the Aged Care Quality and Safety Commission, which have been delayed due to COVID. In providing the very best care to our consumers, we're supported by our volunteers, auxiliary members, and financial donors. Without them, we as a health service could not provide some of the additional facilities for our patients and residents. Our 150 volunteers, 5 auxiliaries, and many external service groups make a significant contribution to help us achieve our goals. The contribution by so many is greatly appreciated. We look forward to welcoming auxiliaries and volunteers back into the service in 2022. Throughout these difficult times, our staff, auxiliaries and volunteers have supported each other through fun activities while raising funds for our health service. Fundraising activities this year included the Resident Support Group Shopping Spree, Toy Library Easter Egg Hunt, and the East Grampians Health Service Auxiliary Movie Night. Last year, the Blue Ribbon Foundation Ararat branch made the commitment to support the purchase of a replacement X-ray machine that will cost approximately $230,000. The Ararat branch has presented 2 instalments totaling $170,000 towards this vital equipment. Thank you to the Blue Ribbon Foundation Ararat branch for your ongoing support. With agreement of the branch, the East Grampians Health Service Board agreed to fund the difference of the equipment so the equipment could be purchased while the building works are underway. We'd like to thank the following auxiliaries and service clubs that have supported us in their fundraising activities. Our volunteers, the Wallora Healthcare Auxiliary, Murray Tamoyne Bike Riders, Cranks and Defibrillators, the Victoria Police Blue Ribbon Foundation Ararat branch, Ararat Breast Cancer Support Group, East Grampians Health Service Building for the Future Foundation, East Grampians Health Service Auxiliary, East Grampians Health Service Residents Support Group, and the East Grampians Health Service ARC Toy and Activity Library Auxiliary, and Ararat Rockers. It's been another challenging year, and as much as we want to be optimistic, we have no doubt that COVID-19 will be amongst us for some time to come. Our community and our staff have been outstanding in their approach to managing these tough times. We want to encourage our consumers of care to reach out to us, to continue accessing healthcare through keeping appointments or video conferencing telehealth. We wish to continue to keep you informed of important issues as we receive advice from the Department of Health. To our volunteers, auxiliaries and service clubs, throughout this year, you have continued to provide extraordinary service, for which we are extremely grateful. To all our staff, you have approached this year with energy and enthusiasm. You have looked to find ways to take on additional responsibilities. You've helped when needed. You've looked out for each other. It really has been remarkable to see you come together to support each other, but also our community. To the board, our sincere thanks for your commitment to ensure that clinical and corporate governance reflect the standards required for our health service to maintain its excellent status within the community as an innovative and creative, safe, quality health service. In conclusion, I'd like to thank you all for attending this evening and continuing to show a passion for your local health service. I'd like to move the report as circulated be adopted and call for someone to second.
Nancy, I'm happy to second. Danny Walker.
Thank you, Danny. I'd now like to invite Danny to share the Treasurer's report.
Thank you, Nancy. Good evening, all. My name is Danny Walker, and as the Board Treasurer, I would like now to deliver the financial report of East Grampians Health Service for the last financial year. These results are detailed in our annual report booklet for further reference. I'll start by stating that on the 28th of October 2021, the Victorian Auditor General's Office delivered their opinion that the financial report for East Grampians Health Service presents fairly, in all material aspects, the financial position of the health service at 30 June 2021, their financial performance and cash flow for the year in accordance with financial reporting requirement of Part 7 of the Financial Management Act 1994 and applicable accounting standards. East Grampians Health Services posted an operating surplus of $451,000 for the financial year ended 30 June 2021. This represents a 0.9% surplus on our operating budget for the year. This financial result, whilst quite positive, belied another challenging year for the health service. COVID pandemic operating conditions from 2020 continued again this year. This meant that East Grampians Health Service commenced the year with another deficit operating budget. Restrictions on elective surgery saw a significant drop in acute activity, whilst COVID swab testing and COVID vaccination clinics became a new feature of East Grampians Health in 2021. These clinics represented new expenditure for the health service. In response to the ongoing pandemic, the Department of Health went further in their support of the health services by reviewing the funding guidelines and delivering specific COVID grants. This enabled East Grampians Health Service to deliver restricted services for the remainder of the year, fund the swab and vaccination responses, and most importantly, maintain our workforce. Ultimately, as a result of the Department of Health support and reduced net expenditure, East Grampian Health Service was able to achieve its surplus for the year. The difficult financial times will continue in the short to medium term as a result of COVID. The board has sought and received a guarantee from the Department of Health that it will fund any shortfall in cash over the next 12-month period. The board and executive will continue to look at revenue generation and appropriate cost-saving measures into the future. We will work in partnership with the Department of Health to balance the budget through growth and versatility of program delivery. Grampian Health Service continues to plan for the future with its ongoing capital works program and continuing investment in staff development. We continued our program of capital replacement and renewal for this year with $3.8 million of additions. This was made up of items of plant and equipment and building redevelopment. Work has continued on the major redevelopment of the theatre and radiology areas, which will continue over the next 12 months. This shows our commitment to expanding, modernising, and responding to local and regional demand. These major projects have been funded predominantly by the Department of Health through their capital division. Support has also been received, however, from the Blue Ribbon Foundation, the East Grampians Health Building for the Future Foundation, plus private donations and bequests. I would like to stress that any fundraising, donations or requests received from the community are separately accounted for and do not go to fund any operating deficit. They are used for capital projects that have an enduring benefit for the community or in specific alignment with the wishes of the donor. We publicly and humbly thank all those who have donated or who have been involved in fundraising efforts. Finally, I would like to highlight the ongoing commitment to staff development at East Grampians Health Service. The Health Service sees support of staff through training and development as crucial to ensuring the success of the service into the future. Whilst this can take various forms, we would especially like to thank generous support of the Building for the Future Foundation and F-Worth Foundation for their bursary programs. I would now like to move for the adoption of the financial report to the meeting. Can I call for a seconder, please?
Second, Nancy.
Thank you.
I'd like to thank all visiting medical staff for their contributions to East Grampians Health Service. Tonight, we acknowledge the contributions of those who have reached at least 10 years of service. Firstly, we have a special acknowledgement to Dr. Derek Pope, recently retired, who has retired after 35 years of sterling service to our health services, but especially to the local community. We wish Derek and his family all the best in his retirement. Tonight, we also acknowledge Dr. Thomas Fisher, 15 years of service. The following doctors have all reached at least 10 years of service: Damien Cleve, Robert Jarvis, Rodney Reddy, Christopher Hengel, Sarah Skinner, Jill Wilkie, Sard Fonseca, Craig Carden, and Julius Tamangari. Our visiting medical staff continue to play a vital role in providing the services we deliver to our community, and once again, we thank them for their contribution.
Good evening. I'm here in place of David, and he sends his apology. Firstly, I'd like to refer to the Epworth Healthcare bursary. Epworth Healthcare has very generously again this year made available a bursary of $15,000 and the East Grampians Health Service is very grateful for the support of Epworth Healthcare, who assist us to recruit and train midwives. This support enables the midwives to keep up to date with the skills and knowledge essential for East Grampians Health Service to provide a maternity delivery service. I'm pleased to announce that this year's recipient of the Epworth Healthcare Bursary is Lauren Cooper, who will undertake a graduate diploma of midwifery. I'd like to invite Lauren to say a few words.
Hi, I'd just like to thank everyone at East Grampians for giving me this opportunity, and also Epworth for donating the money to give me the bursary so I can study to be a midwife. It's greatly appreciated.
Thank you, Lauren. Now, the East Grampians Health Service Building for the Future Foundation have a number of bursaries each year and acknowledge that the workforce is the most critical element in offering services, and we congratulate the Building for the Future Foundation for their initiative of supporting East Grampians Health Services' strategic objective of developing a rural centre of excellence for obstetrics, and these bursaries support this. East Grampians Health Services Building for the Future Foundation is pleased to be able to offer 2 bursaries up to the value of $15,000 each to staff to ensure improvement in the long-term viability and sustainability of the service. It gives me much pleasure to announce that this year's recipients of the $15,000 Building for the Future Foundation bursaries are Marnie Bibby, who will undertake a graduate diploma of midwifery, and Romy Nietzsche, who will undertake a Bachelor of Nursing. Congratulations to both Marnie and Romney. And I think Marnie would like to say a few words. Go ahead, Marnie. Sorry.
Thank you. I just wish to thank the East Grampians Health Service Building for the Future Foundation for the generous bursary amount. This will definitely help me complete my midwifery qualification. Thank you very much.
Romy is unable to be here today, but she has asked that I read a thank you as follows. I just want to say a massive thank you to the East Grampians Health Service Building for the Future Foundation for choosing me to be awarded with this amazingly generous bursary. By receiving this, I will be able to upskill to my Bachelor of Nursing. It means a lot to me and my family, as it will take the strain and financial pressures off us. I'm very passionate about nursing and making a difference to people's lives. So it was a no-brainer when I decided to continue my studies, as this will help me become the best version of myself/nurse. Studying my Bachelor of Nursing means that I can continue to provide high-quality nursing care at East Grampians Health Service for many years to come. I'm excited to further my knowledge and skills to represent this amazing health service. So thank you very much. I'm so grateful. Thank you, Romy. The East Grampians Health Service Building for the Future Foundation have a new bursary, which is named in honour of Joe Capp. East Grampians Health Service Building for the Future Foundation is pleased to be able to offer this bursary up to the value of $15,000 in his name. I'd like to acknowledge both Joe and his wife, Monica Capp, for their generous contribution. And this year it gives me much pleasure to announce the recipient of the Building for the Future Foundation Joe Capp bursary to be Gemma Hardy, who will undertake a graduate certificate in physiotherapy paediatrics. Gemma, would you like to?
Yeah, thank you very much to East Grampians Health Service and the Joe Capp Foundation for choosing me as the recipient to support me to complete additional study in paediatrics. It will allow me to provide a paediatric service closer to the Ararat and surrounding community, and it is something I'm really passionate about, and I'm very excited to bring it to Ararat and surrounds. So thank you very much.
Thank you, Gemma, and thank you.
Thank you, Jill. I'd now like to invite Peter Armstrong to provide some background on the Angela Laidlaw Clinical Scholarship.
Thanks, Nancy. The Angela Laidlaw Clinical Scholarship is donated by the Laidlaw family in memory of Angela, whose love and commitment to the health service inspired Angie's family to commemorate her in this way. Staff working in clinical areas across the East Grampians Health Service are eligible to apply. The intent of the scholarship is to generate benefits to EGHS and the individual staff who are linked to Angela's name and memory, thereby ensuring that Angela's contribution to EGHS and the community continue into the foreseeable future. Now I'd like to invite Jeff Laidlaw to announce this year's recipient.
Thank you, Peter. The Laidlaw family are pleased to be partnered with East Grampians Health Service to award the Clinical Scholarship in memory of Angela. The scholarship is designed to assist members of staff with further education and training and supports East Grampians Health Service strategy in helping staff to develop. It gives me much pleasure to announce that this year's recipient of the Angela Laidlaw Clinical Scholarship is Lacey Honeyman, who will complete a graduate diploma of nursing, specialisation, perioperative nursing. I would just like to invite Lacey to now say a few words.
Thank you, Jeff. It's an honour to receive the 2021 Angela Laidlaw Scholarship. I would like to thank the Laidlaw family and East Grampians Health Service for making this scholarship available to an individual within the clinical services area of our hospital, as well as the support the health service provides for nurses to upskill. The scholarship will financially support me to complete my postgraduate diploma in perioperative nursing. The contribution of this scholarship will provide myself the opportunity for professional growth and therefore increase my skills and knowledge within a specialised nursing field. It's an honour to now be associated with the Angela Laidlaw Scholarship, and I appreciate the support it will offer me. Thank you again, and I hope I can make a large impact on the health service.
Thank you very much, Lacey. I would now like to hand over to Peter.
This year we have a new award, and it is a long name. So it's the Western Victorian Regional Training Hub Junior Medical Officer Award. Tonight, to present the award, we have Dr. Heather Cook. Dr. Cook is an emergency physician and Director of Clinical Training at Ballarat Health Services, Senior Lecturer for Deakin University, and today joins us in her role as Clinical Educator for the Western Victorian Regional Training Hub. Welcome, Heather.
Thank you, Peter. I'm here on behalf of the Western Victorian Regional Training Hub, as you said, or the Hub for short, to announce the recipient of the 2021 JMO Rural Champion Award. This award is given to an intern who has demonstrated a commitment to rural and regional practice during their intern year as part of the Grampians intern program. They were nominated by peers and supported by senior medical staff. I'm pleased to announce the recipient of this first award is Dr. Laura Simpson. In considering Laura for this award, the nominators were asked to rate the following attributes: understanding of healthcare issues in rural settings, advocacy for rural and regional patients, willingness to offer support, mentoring and being a role model, and performance as a valuable team player in a rural health setting. Laura's work ethic, values and compassion were evident to everyone who interacted with her. Laura is a long-term resident of Ballarat with strong family and social connections to the Grampians region and a passion for rural medicine and supporting the community. On behalf of the Hub, I would like to congratulate Laura upon receiving this award. We are certain that she has a bright future as a rural doctor, and we are proud to be a part of helping her attain that goal. I would like to invite Laura to say a few words. Thank you.
Thanks, Heather, and thanks to the Hub and to everyone at East Grampians Health Service. It's a really lovely hospital to work at. So thank you.
Thanks, Laura, and thanks, Heather. So sadly this year again, the board would like to pay tribute to two of our staff members who passed away. Kerry Kilpatrick. EGHS was saddened by the death of Kerry Kilpatrick, a much loved member of our staff. Kerry was a member of the nursing staff working in residential aged care. Kerry will be missed by all that knew her. On this last Saturday, it was great sadness that we were advised that Rodney Taylor died suddenly at his home. Rodney was a valued member of our staff for over 34 years and will be sorely missed. Our thoughts go out to Megan, Brody, Riley and Rodney's extended family, many friends and work colleagues at this very sad time. Rest in peace, Kerry and Rodney.
The graduate nurse program is recent. The recent graduates, of the nursing degree are supported in their first year of practice. I'd now like to invite Danny to read the names of the students from the graduate nursing program.
Thank you, Nancy. So the names of those who graduated the East Grampians Health Graduate Nurse Programs in 2021 for the Registered Nurse Program were Laura McKay, Kirsty Peacock, Tanya Beechenall, Marnie Bibby, Alice Gaffney, Kim Emerson, and Tomoko Parker. We also had in the East Grampians Health Graduate Nurse Program 2021 for enrolled nurses, Kylie Ritchie. Congratulations to all of those graduates, and I'll hand back to Nancy for the Long Service Awards.
Thank you, Danny. Our staff are integral to the success of East Grampians Health Service, and we are indebted to our staff who have contributed to the life of the health service over periods ranging from 10 to 45 years. I'd like to introduce the Long Service Awards. 10 years of service, Lisa Nolan, Claire Homburg, Patrice Rao, Blair Spalding, Elizabeth Lawrence, Shay Halloway, Nicole Berg, Annette Manning, Mary Schwenke, Julie Lang, Jane Stoneman. 15 years of service, Carmel Beer, Suzanne Burns, Kerry Hogg. 20 years of service, Kerry Reynolds, Julie Tierney, Julianne Ricks, Catherine Pitcher. 25 years of service, Lisa McGuinness, Sarah Carter, Rachel Valance, Valma Broderick. 30 years of service, Tracy Walters, Gayleen Veal, Joanne Collins. 35 years of service, Pamela Roach, Christine Perry, Margaret Brown. And 45 years of service, Stuart Kerr. Thank you so much for your dedication to our health service. Education and training is crucial to the success of our health service, and we are indebted to the staff who have undertaken further education at Ararat and Woolora to ensure our community receives the highest standard of care. I'd now like to invite Mario Santilli to read out the names of our Achievement Award recipients.
Thank you, Nancy. I'd like to congratulate the following: Aswin Lal for completing Bachelor of Nursing, Kirsty Peacock completing Bachelor of Nursing, Tanya Beechenall completing Bachelor of Nursing, Tomoko Parker completing Bachelor of Nursing, Alex Proctor, Certificate 4 in Operating Theatre Technical Support, Cheryl Armstrong, Certificate 4 Leisure and Lifestyle, Ashley Walker, Diploma of Nursing, Emma Harrington, Diploma of Nursing, Kayla Pike, Diploma of Nursing, Lauren Foster, Diploma of Nursing, Leah Powell, Diploma of Nursing, Linda Hewitt, Diploma of Nursing, Melanie Sporton, Diploma of Nursing, Natasha Vermeen, Diploma of Nursing, Sandy Golamari, Diploma of Nursing, Stacey Ferguson, also Diploma of Nursing, Tanya Hazlitt, Graduate Diploma of Applied Gerontology, Shay Hannett, Graduate Diploma of Midwifery, Margaret Driscoll, Maternal and Child Healthcare, Lucy Mills, Postgraduate Degree Health Science Gerontology, Elizabeth Lawrence, Rural Isolated Practice Enrolled Registered Nurse. It's just wonderful to see the board and community-led promotion of education resulting in staff increasing their skills for the health service. Thank you, Nancy.
Thank you, Mario. I'd like to thank you for joining us this evening. We appreciate your support of East Grampians Health Service. I'd now like to declare the annual general meeting for East Grampians Health Service closed.